we have Shakib with us. He works in healthcare. He has a background in both data collection and analysis, and he's here to cut through all the different maybe misinformation and give us the hard data. We're actually getting inundated with a lot of different types of information from different sources. So hopefully we can get some take-home messages. What is the current situation? Because as we know, with information and data, it can change. And as such, as it changes, we develop different and better understandings of the situation. So currently, how are we sitting here with the cases in Canada, provincially? Which are the provinces that are faring better? Which are the ones that are struggling a little bit right now? So maybe you can start off and give us a little bit of a background on the Canadian situation right now.
Assalamu alaikum wa rahmatullahi wa barakatuh, Dr. Said. Again, thank you for the invitation and the opportunity to speak to your guests here today. In terms of the update from Canada, today is Saturday, March the 28th, just after 1 p.m. local time in BC, 2 p.m. local time in Alberta, and 3 p.m. Local time in Saskatchewan. So as we're looking at the update, it is across the country, 5,303 confirmed or suspected cases, with 792 in BC, 542 in Alberta, and 104 in Saskatchewan, and 64 in Manitoba, if we're looking at Western Canada. These numbers are changing every day, almost hour by hour. Here in Alberta, where I live, we're expecting an update from the Public Minister of Health within about 2 hours here with the latest caseload for today.
Okay, and do you know the numbers out east? Because obviously their numbers, besides BC, are quite large, right? The Ontario
yeah, that's right.
situation.
Quebec is over 1,000, and Ontario is, if they're not at 1,000, very close to it right now.
Okay, so they're about so the largest caseload right now is in Ontario, correct?
It's actually in Quebec, and the reason for that is Quebec changed the way that they count cases. So all of the other provinces report confirmed cases after they've done laboratory testing. Quebec now reports their confirmed cases as well as their suspected cases.
Okay, so maybe those numbers, because they're being tabulated differently, are skewing those total numbers a little bit.
Yeah, and of course Canada, with 10 provinces and 3 territories, have 10 different health systems, 10 different ministers of health, 10 different public health officials. So sometimes we do have a little bit of a mixed message coming out, but that's just in terms of how we're counting things. And some people want to be a little overcautious and count not only their confirmed cases, but also their suspected cases.
Do you think this is causing some, besides misinformation, but inefficiencies? Like, is there a movement towards better coordination between the provincial governments and entities, and also maybe even federally?
I wouldn't necessarily say so. I know that at the government level, they're having meetings twice a day, every day. They don't stop for weekends. For example, this morning I was on a conference call at 7 a.m. So just because it's a weekend and people are maybe not going to work or working from home, we are still doing that work and we're still meeting regularly. So I don't necessarily know if there's inefficiencies within the system, but some of those differences in how we count things or how we deal with public health or communicate public health boil down to the provincial legislation.